Hi, I'm Dr. Brian Bienowitz of Bienowitz Plastic Surgery. This is one of our operating suites in our office, and I wanted to talk to you about eyelid surgery. Most patients present for eyelid surgery either complaining of either I have droopy eyes or my eyes look tired. And a lot of different factors can play into that. So we'll start basically from the outside going in. There are skin issues, and it can be either extra skin, hanging skin on the upper eyelids, which is drooping and hooding that makes people look older. There could be textural issues, like the lower eyelids, for example, where people have very loose, crepey skin that has lost elasticity and snap. Next layer down is muscle issues. And there could be issues either with sagging muscles of the lower eyelids causing the festoons and bagging below the bone here, or for your upper eyelids, there can be a condition that's called ptosis. That it's not really the extra skin of the eyelid, but the muscle that lifts the eyelid up and down that is starting to stretch out and weaken, and the physical eyelid itself starts to fall down on the eyeball. And that's a very different operation of ptosis repair versus upper eyelid surgery. After you get below the muscle, there's fat issues. And most common area you see fat issues is your lower eyelid, where you have bulging fat that starts to cause the bags around your lower eyelid. You can also have some issues with your upper eyelid with some, sagging fat within the inside portion and the upper portion. So it's important to fully examine a patient, go through all those different layers as to see exactly where the issues are that are making a patient look tired or feel that they have droopy eyelids, and address things appropriately. So going back to the skin, extra hanging skin, you try to get rid of the skin on the upper eyelids. Lower eyelids, I try to minimize any type of skin excision so we don't have complications. I tend to lean more towards doing more aggressive carbon dioxide, CO2 laser resurfacing of our lower eyelids to help smooth and tighten up that tissue. When you treat skin with a laser, you're heating the skin up, and that heat causes a contraction of the tissues, which helps it to tighten up. Muscle issues, so when I'm doing an upper eyelid blepharoplasty, if I see that muscle or tendon has stretched and there is a little bit of a ptosis, it's easy to put sutures in trying to fix that and to elevate the eyelid and make a more youthful appearance. Fat issues require surgery. It's either taking the fat out when you're doing upper eyelid surgery, or preferably for lower eyelids, I go from inside the eyelid to take the fat out of the lower eyelid and treat the bulging. Eyelid surgery is a fairly quick recovery. It's important for the first 2 days that you take it easy, keep your head up and ice. Most people within about 5 days, they're comfortable enough to drive a car. 7 days or so, bruising and swelling is down enough that they're able to get back into public life.